Dementia is a condition that is involved with the progressive change of memory, and this progressive change of memory, which leads to brain damage, and the individuals with dementia can have can be difficult to take care of, presenting with some of the difficulties that the families that have these kind of patients are encountering. So some of the behaviors that can be overwhelming include wandering. We have these individuals, they can be walking aimlessly, and this can be overwhelming because the person keeps on walking all throughout with no purpose. This can be due to some unmet needs, or could be to some of the memory changes. Usually, sometimes it's difficult to contain the individuals, and when this happens, then it is good to ensure that they are walking in areas that are secure, so that you ensure they continue walking, but they walk in an area where they cannot fall, and also they cannot get away because sometimes they can get lost. So, maintaining them in an environment that they are used helps them, because there, if they get out of areas that they have been restrained, then the people around them will be able to recognize them if they wander away. The other problem that can happen is persistent pacing, where the individual is just walking around in one spot, and they aimlessly. That could be due to unmet needs, including psychological and physical. The physical needs include things like hunger or thirst or excessive noise. So some of the ways to sort out this would include getting the individual to get the need that they may be affecting them. Like if they have not eaten, possibly suggesting if they would need to eat, or if they would need a drink, or if they would need to use the toilet. So this will help the individual to identify what is distressing them. Then repetition of questions. So they will keep asking you the same question over and over, and this can be overwhelming. To deal with this, you may need to help the individual possibly change the topic, or engage them in a way that they will be able to tell them what is it they exactly need. They also have behaviors of rummaging through boxes, clothes, and also their belongings, put them in processes, and possibly they might be looking for something, but also is a behavior that can be overwhelming. Sometimes, if it becomes too much, you can give them a box of clothes, of their own clothes, and they keep looking through, and this will keep them occupied, and help them just not to be agitated. That they may have delusions, which is not the correct situation of the situation. And when this happens, try to redirect the conversation, and also engaging them in a conversation that they seem to be interested with. They have hallucinations, which is a feeling and a seeing of things that are not there. And this you can manage with redirecting their attention. Sometimes they may get agitated with things that might not be necessary to cause the level of agitation that they might cause. And so this could be due to unmet needs. And also, one of the ways to deal with this is, first of all, trying to reassure the individual that you are concerned about their concerns, and showing care. So individuals with dementia also, they may have difficulty feeding. Sometimes helping them with hard gestures, and trying to direct them, maintaining what capacities they have, assisting them in feeding. Sometimes just holding the person's hand and directing them, and they keep reminding them to feed. If they reach a point that they cannot be able to feed on themselves, then they may need to be assisted to feed. And sometimes, if the condition progresses to some situation, then they may need supported feeding with gastrostomy tubes. Then, in the early stages, they may have difficulties with dressing. They will need dressing, and sometimes they can be difficult. So, trying to ask of their opinion about the clothes they want to wear, and directing them, giving them choices to choose the clothes they have. But of course, like, you can choose two clothes and they ask them, if you want, which one do you want to wear? That will make it easier for the person to make a choice rather than giving them a whole lot of clothes to choose them. Then bathing, creating a routine for bath time, and don't engage the person with the insistence, is directing them and asking of their opinion. And if you make suggestion of the things that they like and of what they want to do after the bath, possibly that will help. So dealing with the individuals with dementia can be overwhelming, and learning some of the skills to take care of their daily needs would be helpful. Thank you for watching.